I'm Sarah Turner.
And I'm Gayani Rahim.
We are the Young People's Midwives for the Borough of Greenwich. This is a video with some information about yours and your baby's journey from conception to birth. You can dip into this video at varying times throughout your pregnancy to learn about each stage of your developing baby's life.
In the first few weeks of pregnancy, your baby changes from a ball of cells to a fetus with a beating heart, developing organs and arms and legs. At the end of the first 4 weeks in pregnancy, the heart and lungs begin to form and the heart then begins to beat. Between weeks 5 to 8, all essential organs and body systems are in place, including the placenta and umbilical cord. The eyes and ears start to form, fingers and toes, wrists and ankles are developing. At the end of 8 weeks, the baby measures around 3 centimetres and weighs less than 1 ounce.
Here you can see a replica of an 8-week baby and your uterus, which will house your baby throughout the duration of your pregnancy. You might find at this time in your pregnancy you are excessively tired. You might suffer from some nausea and vomiting and maybe some breast tenderness as well. If any of these symptoms are severe, please talk to your midwife. At around 10 weeks, soft nails will appear on the baby's fingers and toes. Also, some tooth buds which become baby teeth are developing beneath the gums. Here you can see another replica of a baby at 10 weeks. You can see just how much it's changed in as little as 2 weeks.
During your 12th week of pregnancy, you may find your breasts are larger, they feel slightly heavier, they may appear more veiny, and the areola appears darker. Try to keep up regular exercise and limit the amount of caffeine. Avoid all alcohol and smoking in your pregnancy.
At this stage, baby measures from head to bottom around 8 centimetres. The baby weighs around 20 grams, which is less than 1 ounce. The baby's fully formed and all vital organs are now present. Baby's sex organs are well developed, although these can't yet be seen on ultrasound. Movements do occur, but they cannot actually be felt by you just yet.
At around 16 weeks of your pregnancy, if your nipples and areola haven't already, they may darken. The greatest risk of miscarriage is now past. Any nausea and sickness should begin to subside.
The baby now measures around 10 centimetres from his head to his bottom. It weighs around 120 grams. The baby now begins to grow hair on his head. He's got eyelashes and eyebrows beginning to develop. Lines and creases will start to appear on both hands and feet. He's now got a strong heartbeat and you might start to feel some baby movements, especially if you've had a baby before. Do not worry if you do not feel movements yet. Most first-time mums will start to feel movements between 18 and 21 weeks of pregnancy.
During your 20th week of pregnancy, you may notice your waist has increased in size. You may find you have a small bump and you may have started feeling some baby movements which feel a bit like butterflies fluttering.
The baby measures from head to bottom around 15 centimetres. He weighs around 300 grams. The baby has strong movements. Most mothers can just about start to feel this like butterflies. Baby can now suck his thumb. He can now also hear your voice. By 22 weeks, the baby is also covered by soft fine hair called lanugo.
At around 24 weeks, you may notice your bump is getting bigger. Try to maintain a good posture to avoid backache. Your breast may start to produce colostrum.
Baby now measures around 20 centimetres from its head to its bottom. It will weigh around 550 grams or just over a pound. Baby will now be covered with a white greasy substance called vernix, which protects the baby against the amniotic fluid. This usually disappears by the time the baby's born. Also, baby's hearing is well established and he may jump to loud noises. Baby can now swallow and pass urine, and baby has often developed a sleeping pattern. The fat stores are beginning to be laid down, and baby can wiggle toes and grip with both hands.
At around 28 weeks, you may feel tired. At your midwife appointment, we will check your iron level. Stretch marks may appear. The physical discomfort of carrying extra weight may start to take its toll, and you may experience common complaints such as backache, breathlessness, indigestion, and swelling of fingers and feet. Please speak to your midwife about your symptoms.
The baby now measures around 24.5 centimetres from his head to his bottom. He should weigh around 2.5 pounds. He has now got eyelids that can open and close. Baby is very active now. The lungs are strengthening in preparation for birth, and he can now tell the difference between night and day. Baby can now also recognise the sound of your voice and others around you.
At around 32 weeks, you may start to experience problems sleeping at night. This is preparing you for life with a newborn baby. You may also find that you are needing to go to the bathroom more often at night. This is because of the extra pressure on your bladder.
Baby now measures around 26.5 centimetres. He weighs around £3.12. The baby will also now start to gain more weight, and the vernix and lanugo start to disappear. Baby's skin will now become less wrinkled.
At around 36 weeks, you may notice tightening of the uterus. These are practice contractions known as Braxton Hicks. It is now a good time to have your bag packed for the hospital.
Baby now measures around 46 centimetres and should weigh around 6 pounds. Baby should also now be in position ready for birth.
Between 37 and 40 weeks, your baby's done all its growing and is now ready to be born.